Welcome to another episode of Circular Wellbeing by Union Assurance, a program dedicated to enriching the well-being of all Sri Lankans. In today's discussion, we are going to talk about a topic that concerns millions worldwide, the impact of smoking and alcohol on our well-being. Joining with us today is Dr. Alan Ludowyke, the former chairman of the National Authority of Tobacco and Alcohol. Welcome to the show, Dr. Alan.
Thank you so much for having me.
Dr. Alan, what are some of the long-term health risks which are associated with smoking and excessive consumption of alcohol?
Yes, each of them has detrimental effects on the body, on almost every single organ of the body. But they do have serious consequences to particular organs of the body. So if we take smoking, obviously the most common effect is people consider that it affects the respiratory system, your lungs, because you inhale smoke into your lungs. So obviously it's a carcinogenic substance. Tobacco causes lung cancer, that is proven, and but lung cancer is not the only problem. It also causes problems to the respiratory tract. It destroys the cilia in the lining of the tract, which basically helps you to bring up foreign particles that get into your airway. That's why smokers have a chronic cough, because they have destroyed that ciliary escalator mechanism. And so they are also subject to chronic obstructive pulmonary disease and airway conditions like emphysema. And so the lungs are dominantly affected by smoking, and of course heart disease. So it causes a major cause for heart attacks, major cause for blocking of the arteries as a result, which is called atherosclerosis. It also thereby then affects them through strokes. So there are serious heart consequences, even affecting the muscle of the heart, which we call cardiomyopathy. There is also the effects of smoking on the kidneys. It affects kidney function. It also affects our immune systems because it lowers our immunity. It also affects aging, and many people don't realize that. Smoking increases wrinkles and sagging of the skin. And in fact, if you look at the face of a smoker, doctors are often able to recognize it merely by looking at their face that they are chronic smokers. When you take alcohol, alcohol too has many effects on the human body. Obviously, the first thing that we think about is the liver because of alcoholic liver disease, but that is not the only effect. We know that it can go on to lead to hepatitis and cirrhosis of the liver, and that affects the entire body because the liver function deteriorates, and when the liver packs up, the clotting factors which are produced by the liver, the proteins that are produced by the liver cause serious effects to the rest of the body. And in fact, it causes a very, very serious consequences when the liver packs up and people are basically dying. And when you have to see someone dying of alcoholic cirrhosis, it's not pleasant. It is one of the saddest deaths that you can see. Alcohol also affects the kidneys, it affects the bones, it affects all these organs and also the immunity as well. And when you put them together, the synergistic effect of both of those substances together just adds to the risks and the bad effects of both of them. So avoiding them is hugely beneficial in the long run, so that you maintain a better state of health.
How does smoking and excessive consumption of alcohol interact with other health conditions such as heart diseases or even diabetes?
Yes, smoking and alcohol has an impact on several health conditions, including cardiovascular diseases and conditions like diabetes mellitus. The fact is that alcohol consumption affects the control of blood sugar, which then is a serious issue for the control of diabetes. It affects the medication that you take. It affects how you will control not only your blood sugar levels, but the amount of food that you take. So alcohol too is very detrimental, because to some extent alcoholics tend to eat differently, the diet. Often they consume alcohol and do not take food till very late. It seriously affects the way you control diabetes, and especially those who are insulin dependent diabetics. Cardiovascular disease, of course, is a condition that affects the entire body. And so when you combine that with smoking and alcohol, again, it affects the heart because it causes heart attacks. It causes a deposition of plaques in the arteries of the heart, what we call atherosclerosis. And then that leads to the heart attacks that we see so frequently, especially in young people these days. Much younger people are having heart attacks because of the risks factors that they have included into their lives, like alcohol and smoking, and the stress levels that they have to face in the modern working environment, have all contributed to having a serious impact. And it's not only those conditions, it's the kidneys, your bones, your immune system, your mental health is also affected. So there are many disease conditions that are seriously affected by your level of smoking and alcohol intake. And in truth, even a small amount, even an occasional smoker or an occasional social drinker has effects on their health and on these disease conditions.
Dr. Alan, what are some of the common misconceptions that people have about the risks of smoking and drinking?
Yes, there are quite a lot of myths involved with both these substances and their abuse. When it comes to smoking, a lot of people just think that it only affects the lungs. That's not true. It affects many of the other organs of our body, and certainly the lungs predominantly, but it affects your heart, it affects your bones, it affects your entire upper respiratory tract. It causes cancers of so many organs in the body, not just the lungs itself. They also believe that smoking is only harmful to older people, and that's not true. It's harmful at any age. It's harmful because it affects the young developing mind as well, and so it's harmful to very young people when they first start it, and it affects their cognitive function, so it's very harmful. They also believe that vaping is less harmful than smoking, which is not true. Vaping is as dangerous as smoking, because vaping has nicotine, and also it has other chemicals in it which are also carcinogenic. The data is coming in, and it is not safe. So it is not a safe alternative as the industry would like to promote it. It is very dangerous, and it causes a lot of health issues, and especially for the younger people and the ladies out there who are trying it because it's flavored. It's extremely dangerous for your health. And I am pretty sure in the time to come, not only is the data going to come in, but it's going to prove that it's as harmful as smoking. The other things that are common myths with alcohol is that there is in moderation it's okay. It's not. The WHO has finally come out and said in any quantity smoking is harmful. Even a little bit of alcohol. They used to think that a little bit of red wine was good for your heart. It's not so. It affects the body. It affects you in small quantities. And it's actually not even the type of alcohol. It is the quantity that you take. So some people think that beer is okay, it's safer, but no, it is also drunk in huge quantities. And that's actually the problem with in our country. It's, even though we have only about 30% of our people who drink alcohol, the problem is that the per capita consumption is very high. So they drink till they see the end of the bottle, which is very sad because they do not even know how to enjoy a drink. They drink till they are inebriated. That's why it contributes to so many accidents, so much of abuse and violence, even domestic violence, and so many things that are socially difficult to handle because of the side effects of alcohol. So there are other myths as well that need to be challenged, like the actual effects of alcohol, which are really very, very clear, especially the first time you drink. The first time you drink, you will feel nausea and vomiting. Your reflexes are slowed down because alcohol is a depressant and your coordination goes. It's not a stimulant. So many of the effects that people believe are due to alcohol are actually socially conditioned. It is what society teaches you about the effects. It has nothing to do with actually the effects of alcohol on your body. So alcohol is a depressant, and even though it's a depressant and you do feel drowsy, it doesn't actually give you a good sleep because it affects the type of sleep that you have. It affects the quality of your sleep. You in fact don't get good rapid eye movement or REM sleep. So you get poor quality sleep, which doesn't really help you get a good night's rest. So there are several misconceptions that are out there in society, and we have to address those issues because they are myths and they need to be exposed as that.
So Dr. Ludowyke, how does smoking and drinking impact the brain development of the adolescents?
Yes. In truth, brain development starts, as we all know, from the time of the fetus and moves on to continue till about the age of 25. So there are serious effects on the brain during early adulthood, even adolescence, because the brain is developing, the neural pathways are developing. And alcohol and tobacco have effects on the brain development, even structurally. Certain areas of the brain are affected, like the hippocampus, and thereby cognitive function is affected as well. There is certainly a decline in the ability to concentrate, the ability to handle stress and anxiety, and because it affects the brain. And so both tobacco and alcohol have effects on cognitive function, on the actual mental health issues that they are faced with. And so while they struggle with stressful situations in life and their ability to deal with it, alcohol and tobacco is not the answer, because in fact it contributes to greater difficulties with handling of anxiety and depression especially, and can contribute to difficulties even in treating those conditions because of the bad effects that it has on their mental health state. We would like to see that people who are developing are able to concentrate on their in that time of their life, in their studies, in their work, that they be able to put their best efforts forward. But tobacco and alcohol really don't help in that area, and they cause addictive behavior, which again impacts the ability of young people to be productive and do their work without also the consequences on their health, which is I've already spoken about. So all in all, together they have quite a difficult time when used and abused by young people, and we believe that it would be best that they reevaluate their choices, especially for the developing brain.
Dr. Alan, what are some of the treatments that individuals can take to help them quit smoking or reduce the excessive consumption of alcohol?
Yes, actually in quitting there are different types of therapies, and very often those have to be customized to the individual and sometimes used in combination. So of course, for smoking, there is easily replacement therapy, which of course is not used in Sri Lanka. We do not use nicotine replacement therapy. Our consultants believe that nicotine is not so addictive that after 2 or 3 days you cannot withdraw from it. So we do not use nicotine patches or gums or lozenges, which are used in other countries. But we believe you shouldn't have to replace one thing for another thing, which then makes you dependent maybe on those things for quitting smoking. So we would prefer to give them cognitive therapy, behavioral therapy. As you know, many of these habits are due to the environment, due to certain triggers in that environment that the individual has that causes them to want to smoke or even to want to drink. So those trigger factors also can be dealt with. There are of course drugs that help with withdrawal symptoms, and that should be prescribed by a medical practitioner. That would be useful for certain individuals, but not necessarily for everyone. Especially with the nicotine addiction, it can be overcome through various therapies that help them, like mindfulness and yoga, meditation, helps many individuals so that they can have a better state of mind, which is often sometimes because of the anxiety they face that causes them to want to take something to relieve what they believe will relieve their difficulty. But in truth, it's only momentary, if at all. It is more due to their habit that they continue. So the same with alcohol. There are many types of therapies. There's gradual reduction, and we help people with that. There's of course the very famous associations like Alcoholics Anonymous worldwide, which has a 12-step treatment plan that they follow to help a person. There's also quit line services. In fact, the National Authority on Tobacco and Alcohol runs a 24/7 quit line service. It's 1948. 1948, the year of our independence, where we got our freedom, and we hope that people will also get their freedom from the use of tobacco and alcohol as well, and that's why we have picked that number. So there are trained counselors who are available 24 hours of the day, 7 days a week. If you like to quit, please call, and there will be someone who will help you. And if you need follow-up, they will refer you to the nearest hospital where they will help you in a clinic to also overcome, because some people will need follow-up because their addiction maybe is something that is harder to overcome because of the period of time they have been using it. But there are a combination of many of these therapies can be used, whether it is medication for withdrawal or cognitive theory or behavior theories are there that help people to disassociate with what they think are the effects of alcohol. There is support groups that can help them, and there are counseling services as well and in our country. And so I think it is best that a combination sometimes works well for individuals, but as I said, we have to tailor these therapies to the individual and their particular situation so that we can help them have a better quality of life.
Thank you, Dr. Ludowyke, for sharing those valuable insights with us today.
You're most welcome.
Stay tuned with us for another episode of Circular Wellbeing.